and welcome again to the Executive Room podcast, where we delve deep into the minds of remarkable executives who have shaped the business world with their ideas and actions. I'm your host, Kimberly Afonso, CEO and founder of the KA Consulting Group, where we are visibility and influence partners to some of the most visible CEOs of our time. And today, it's an honor to have Trevor Colhoun join us. Trevor is the CEO and founder of TPN Health, one of the fastest growing professional networking platforms for licensed behavioral health clinicians. With a career rooted in capital markets and private equity, starting at Bear Stearns and Piper Sandler and later working in operational turnarounds, Trevor brings a deeply analytical, systems-oriented approach to complex industries. It has been great to see everything that Trevor has done through his founding at TPN Health to build the first true digital marketplace and infrastructure for clinicians, treatment providers, and health plan partners. In just over 5 years, the company has grown to an engaged network of over 90,000 providers and is now expanding into new partnerships to improve access, outcomes, and cost efficiency for millions of member lives. Trevor's leadership philosophy reflects a culture of candor, self-respect, intellectual honesty, and deep commitment to purpose-driven work. Under his leadership, the company is on an ambitious path to bring modern marketplace mechanics, digital tooling, and simple but powerful processes to one of the most essential and underserved sectors in healthcare. So great to have you here today, Trevor. Your background was in capital markets, private equity, not always healthcare. I'd love to start by hearing a bit more about your story. Why did you decide to move into behavioral health? And, really impressive. You've grown TPN Health to, a network of over 90,000 providers. Tell us more about how you got there.
We're actually 100,000. We're over 100,000 now. So
oh wow, amazing!
That's an announcement we'll make soon, and we've added about 7,500 providers this year alone.
Wow.
So we're elevating significantly our acquisition growth of providers. But the journey into this space is, I have never been interested in healthcare prior to TPN. In fact, in my investment banking sell side days at more, what is now Piper Sandler, we had a very strong healthcare team and research, and it was nothing that I paid attention to at all. I was always 100% technology, really fascinated on how leveraging technology can change the efficiencies of not only our society but business and maybe societal health, and how the transition really happened for me, especially into TPN, is a human personal story where we had a family member go through a behavioral health journey, and being a close caregiver in that story, really got a front row seat to understand how analog the market was, where we would go to a different state for interventions and facility help, and these were the best in the country. And then when you leave, you go back to your communities, and you're on an island again, and they don't know who you need to see, and the continued care wasn't there, and the connectivity. And I had a unique background in terms of watching the digitization of the financial markets, right? And what has occurred in terms of transparency and the ubiquity of data and information. And that's really, has been going on for many decades and has obviously, ramped up Moore's Law. But we really took the philosophies of how data is consumed and connectivity creates to kind of apply that into behavior health, and really didn't know a lot about healthcare, behavior health, but we knew a lot about marketplace and systems and information and how you create value and how you show value. And really our big issue in behavioral health was not what everybody was saying is stigma or lack of access. We really saw the issue in behavioral health being a lack of a value proposition, meaning if I enter into behavioral health and I am going to transact to get peace or sobriety or stronger relationships with myself or others, what does that cost? What does that look like, and how long does that take? And the market innately can't answer those questions. And it's a massive elephant in the room, and let's be clear, TPN isn't saying like we've solved that problem, because we haven't. What we've solved and what we're solving is how do we digitally organize this market so professionals can, right? And we can have an infrastructure to do so. So we kind of, when you think of us at an end result, we're trying to be a national digital hospital network, right? So if I go to Kaiser Permanente or NYU Ken Langone or Ochsner or whatever network of hospitals I'm going to, right, I understand the value prop on the physical health side, right? I understand I broke my leg, okay, and I go see the orthopedic, I might see my primary care, and then I go through a litany of tests, and I can get a second opinion. I understand the cost around this, and I understand kind of the time around this, right? So rehab and back to walking and all that stuff. That is not clear at all in behavioral health. And there's a lot of different variables in this, right? There's willingness, right? So willingness from the participant to actually want to change and work on these things. There's many factors to kind of get there, but there's a lot of blocking and tackling that can occur in this market that we're providing that will be able to significantly lower cost and increase outcomes and efficiencies.
Well, it seems like a lot of the infrastructure, is missing that you're building in this entire, marketplace. Do you think that your outsider perspective, as you didn't come from the behavioral health field, helped you initially see opportunities that others didn't?
Yeah, yes and no. I mean, the quick answer is yes, and the other answer is, there's probably things we could have done to speed up our process. And I think if the last 12 months will tell you everything, we've been very focused on who we hire to bring in that would bring in those expertise, so we're not making those issues. But yeah, not knowing, as we look at the behavioral health market, you've seen this fight, okay, between the clinical aspect of behavioral health and the financial aspect of behavioral health, right? And they don't communicate or understand, speak the same language. And that's really where the value prop needs to come together. And the typical provider, likely so, will hate insurance, right? And hate private equity and hate venture capital. And I get it. I would too, because they have, and they're not the bad guys. They just aren't really informed holistically about the issues of the market and understand where the market is. So I think a lot of the capital that's come into this market has thought that the behavioral health market is a structured market and has good information, connectivity, data, and analytics. It doesn't. And so if I'm coming into the physical health market, I can be transactional, right? And I can understand systems and point systems that would come in to save. And a lot of the companies and products that have come into this market have been endpoint solutions or transaction, meaning, hey, I'm going to contract you, you're going to come in, and we're going to pay you, right? But they haven't really figured out that the payer doesn't really understand how to engage with the payer, with the provider doesn't understand how to engage with the payer. They haven't really been able to articulate outcomes data and value prop data to them, and so it's frustrated the payer side of the market to kind of qualify and understand what they're paying for and if they have to pay for. And we came in not focusing on that transaction at all for the first 5 years. And, I think because of that, it was a massive risk and kind of a science experiment. But through that process, we've built a hell of an asset and a hell of a relationship with providers, because we're provider first. We don't focus until about 12 months ago anything transactional with the provider. And we still don't require any money or a contractual relationship with the provider in terms of you have to use us or this, that, the other. We want it to be hey, if we're good, use us, right? Bring us into the fold. Like, we want that relationship with the provider. And we really focused on honoring the provider in terms of what do they need to advance themselves as a professional? How do we make their lives a little easier? So, we first built this in 5 quarters, really this LinkedIn bespoke B2B marketplace for them to come in and have an account and connect and engage and then to refer to each other, which, in hindsight was what we had to do. And I probably wouldn't change that process at all. But it also, when it launched, it was crickets. Like, nobody cared. We thought, providers are going to love this. This is all the things they need. But no. And what really was the turning point for us is we built a massive learning management system for their continuing education, because providers need continuing education for several processes. One, to maintain their license in the state that they're regulatory, or the many states they're licensed to, or they want to elevate themselves and get certain modality certifications, like they want to get DBT skilled, or they want to get EMDR, or whatever they would need to be a better provider. And that's really where we focused on the first, looking back maybe 4 or 5 years. And so through that process, and other utilization that we put on the site in terms of managing that CE wallet digital process, or the connectivity to other providers and to referring to each other and building your own networks of referral networks and stuff like that. That's allowed us to be now, I would imagine, one of the largest learning management systems in the country. We did 900 workshops last year alone in terms of continuing education. So an hour to 3 hour CE workshops, and then it allowed us to, again, we've kind of every year doubled our size in terms of providers. So, and we seem to be on that track again this year. We're not planning to be, but it's going that way. But so that's really where we've focused. And once we've had this digital aggregation of providers, then we realized, okay, we can now build other things that are useful to them, to their practice, which the holy grail of useful to them or anybody is, hey, can you keep my lights on and provide me with a client, a patient, a life that fits my practice, and the skill set that I have that I can see and maintain. And we worked on this for a while, and we really answered the question of, yeah, we could do that, and I could walk you through how, but we can also pay you more than really the market can, because of this digital relationship we've created with you and our ability to credential you and adjudicate you and have attestations. We can actually remove a lot of nonsense and noise of other companies that are involved in this and other vendors, where we can connect you directly to the ultimate payer and have nobody in between. And that's a very transformative process here, where the provider can really understand transparently where the funds are coming from, how it's related to my patient, and really start to engage into the insurance market, which has been a huge fail in the behavioral health world. The cash pay market of behavioral health, while it's great, it really doesn't serve. And we could kind of get into that problem if you want to. It's been a big issue for the participation of, really professional U.S. citizens to engage in behavioral health.
Wow. Well, it sounds like, you've really developed a system to not only vet the, everyone who's using the platform, but also maintain trust. Is there anything that you've learned from that process that, you'd like to share or that you think could be useful to other companies who are maybe building digital infrastructure or digital communities?
Yeah, I'll talk with the internal side. For us as a company and an employee base, we're very intentional about many steps in terms of our culmination of colleagues, and then intentional about how we're communicating our culture. And we, first I'll talk about, when we go to hire someone, we're very purposeful about the three things in the order, right? Like, do you want to be here, right? Is this something that tickles you and you want to be a part of and gives you purpose, right? And I think this is very thought of us, is this is time away from your family, your friends, right? This is something that could bring pride to your life, not just TPN, but it's your job, right? It's kind of, who are you? And is this something that you want to be? Who are you? And then the second part is kind of a character piece. What are you when no one else is looking, right? Is this something that you're going to put your hand up because you're seeing something that's unethical or not right? And that's a hard one to judge in a couple meetings, but doing a little digging, you find out. But it's definitely something we talk about on the call. And sometimes when you just talk about things, you learn things. And then the third thing is skill, which is the third thing. It's not the first thing. And we think that if a person wants to be here and they're a good character person, then we can train them into, our process. We're an internal engineer shop, so I don't know, we have 12 maybe engineers or something of that nature. We're a tech-heavy shop, so they got to have the skill there, but they also have to understand kind of the mission and the vision. And so, which is the third thing is we, unbeknownst to us, really because of those things, really focused on our culture in terms of creating a space where people had voice, to from the factory floor, for just a metaphor, can come out and say, hey, this isn't working out, and everybody would listen to them and hear, and have a voice and be part of the process, is important, because that's really how we learn and grow, but also hear from the customer. A lot of our tech build comes from our customer success team, who manages the current partners that we have, but it also comes from the customer support team, who are taking in calls from people like, I lost my password and I can't get it, things of that nature. So, so that's, and they can build their own tickets, meaning they can go in and say, here's an issue, I have an idea to build it. Everybody has the ability in the company to build their own ticket. And then, our product team kind of decides, is this something, where does it fit into once we do, or maybe we have a ticket and this is kind of a, enhancement to that ticket. And then we were really surprised. 2 weeks ago, we did an on-site with a wonderful gentleman in San Diego who came in, and he was the head of culture at Big Bad Microsoft. And I was apprehensive about that whole process. And I talked to him a lot, and then I just kind of handed it over to God and said, you come in and you do what you have to do. And so we did a principles study on ourselves, about culture, and we scored really well in our culture, in terms of having safety, having trust, feeling heard, things like that. We didn't score so well in clarity. And the guy who ran it said he's never seen that before. And we were very excited. I feel like I'm Donald Trump right now. I scored so well. No, but the reality is, it's a good thing and a bad thing for us, because we, culture is a hard thing to create, and it's a hard thing to build, and we've been intentional about day one. So that's kind of my lesson here, is to be intentional about what you're trying to build, what you're trying to say, and what that should be. The clarity thing is something that I'm very focused on, and kind of what came out of this is me, instead of being the CEO, be the CRO, the chief repeating officer, and constantly, engaging with colleagues about our vision, where we're going, what are the wins, what are the losses, where do we want to win, where do we want to focus, things of that nature. So that's super positive for us. The clarity piece, really comes through SOPs, right? And those are, this is just pulling up your sleeves and getting that stuff together. And our expansion and kind of where we are right now is quite explosive, where we've taken I think we're up maybe 30% in terms of employees in the last 40 days. So, we're bringing in a lot of folks, we're onboarding them, we're building onboarding processes, offboarding processes, really, honing down on everybody's roles and responsibilities and ownership and KPIs that they own and what their deliverables are. So, what's our cadence in terms of feedback and all of those things. So
amazing. And going a little bit more into culture, I really liked an interesting philosophy you have when you said we are kind, but we are not nice.
Yeah.
So can you explain what that means in practice and how that fits into some of the other things you were talking about? And kudos. It really seems like you've built a great company culture, which is not easy to do.
Yeah, thanks for bringing that up. That was something I wrote a document for everybody about who is a TPN employee. What does it make? So for onboarding, they can kind of get a sense, or maybe even looking at us. It might be even on our website. I don't know. But kind and nice is something that is not mine, and I've really picked up over the years in terms of the difference of being someone of internal fortitude and character and self-love, understanding who you are, but also being respectful to other people in that realm, right? So, and doing that as a person, but also doing that as a company, right? In terms of, what we do and what we don't do, and where we stand and where we don't stand, and where we connect and where we don't connect. And, I think a company that is nice is kind of a growth at all cost, right? In terms of, not understanding what your principles are, not understanding what you're trying to create, not understanding who your customers are and what their needs are, and just pushing everybody as hard as you can just to turn that dollar. Now we're a for-profit company, and we're bringing capitalism into behavioral health, and we're very clear about that. And that's probably the kind side of us. It's like this world of behavioral health and infrastructure and ecosystem needs capitalism, right? They need to understand, if you are complaining as a provider you're not getting paid and my value from the payer's not there, it's because you can't show your value prop, right? And we want to be kind and articulate that, and we want to be kind and give process and flow to show that and demonstrate that to payers, but also, we want to be clear who we are, and it also goes with relationships with partners. Like if we're being disrespected by a partner, we're going to be nice. I mean, we're going to be kind about it and say, but we're not going to allow it to happen. There's kind ways of going about it as a company. But I think a lot of it goes in the function of who we are, defining who we are, where we're going, honoring the mission, and also functions of, I talk about this a lot with the staff, is we're a sports team. Okay, we are not a family. You have your own family. I don't want to be your family. I don't want more family. I have a great family, and those get my heart and time away from this. And a lot of the reasons I do this is for my family. But we're a team, and you could think about it of a bus going in a direction, as some people talk about it. You could be on the bus, and we need certain people on the bus to make the bus go. And if you don't fit that bus anymore and where we're going for certain reasons, then you're not on the bus anymore. And, I've gotten a lot of feedback from people that have joined us that have heard that piece, and a lot of folks that have been with us, and they appreciate that because it's disingenuous. Because we all know that family asks us to do things we don't want to do. But we do it because we love them and we care for them, and that is our sacred honor. But that is not for me to ask an employee to manipulate them and have them do something that is not in their job description or not what they're onto, or extra pieces for them not to do. And that's really those are kind of the dark sides of family. There's beautiful sides too.
And that's a great one. That's one I haven't heard before, but I love that comparison between family and the team, because the team, it makes perfect sense. So I'm going to remember that one for myself as well with my own team. I'd love to hear now a bit, Trevor. We always talk about visibility on this podcast, and the reason I invited you on is because you've built a really strong LinkedIn presence. You've been in the media, you've been on other podcasts. So tell us a little bit about what has that done for you and for your company? And also, do you have any advice for other CEOs or executives who want to develop their own personal brand but haven't started yet?
Well, I think I'll start in reverse. I think for all people starting a company and all people going about or building a brand, stop and make sure that you've done some personal work on yourself to understand who you are. A lot of people talk about this general thing as what is your why, but I'm talking about, getting connected with, your family of origin, your inner child, checking into, how you are engaging and the inner voices in your head and things like that, before and I think that process really helps someone kind of center in on the genuineness of themselves, and the internal aspects of themselves. And then I go and talk about what you want to talk about, right? Who you want to be. I mean, for us at TPN, it's quite a wonderful platform of clarity, of who we are and what we're trying to do and where we fit in this thing and what we're trying to build, right? And now that we have had that over the years, now we're very focused on, well, especially this year, we've never marketed at all. And so we will do that this year. We'll do PR. We've never done PR. We'll do some significant paid marketing, which we haven't done. But leading up to that, there are tools to use. And you mentioned LinkedIn, which I think is the most important on the professional aspect of building. It's a vote every day, right? So people vote with their pocketbook, or they vote at the stalls to find out what's going on. And they also vote with their connections and comments on LinkedIn. And it's currency. So the more you engage with LinkedIn and build a presence and build connections, then as it gets to a certain aggregation and level, then there are people like, oh, well, this is a serious person. They've been around. They're connected with people I know. So I think it's a wonderful tool for that. And there's things in TPN we've taken from them and will continue to build within the bespoke nature of behavioral health on our platform. But it's a very powerful tool, and you get a lot. You will get some inbounds that are like, I would say 80% of the stuff I get is someone's trying to sell me stuff that I don't need, and then they're like, "You need this." I'm like, the arrogance of you selling me something, telling me that you have no idea what happens within my business that I need this is a horrible sales tactic, by the way. So if anyone is listening and doing that stuff, do not assume in your sales process to assume that I need something that you're selling. We will decide that. And remember that when you're selling. Respect your audience. But back to LinkedIn, it is a very powerful tool. We use it sometimes to replace PR, newswire things, right? And I'll be making a large announcement this week of a person that's joined our advisory board that we're very excited about. And then for the company itself, it's something that we have not focused on, and we did now maybe more intentionally 3, 4, 5 months ago. It matters too in terms of your distribution of information and connection with the audience to really focus on that channel, which our CMO is now kind of really engaged with. And then there's other things, focus on the AI where they pull from. I mean, they pull from Reddit first, and then they pull from LinkedIn. So AI wants to be as close as they can to a human and information of what's going on, and that is the engagement, right? So it's going to be Reddit in terms of articles that people have iterated on, and they're learning from that iteration and those cadence of conversation, stuff like that. And it's going to be from LinkedIn when someone's getting a direct connection to a person who's communicating who they are in a professional aspect. So that's a fast growing, as we all know, delivery search and delivery those AI channels.
Yeah, very well said, and also really great that you know so much about that, Trevor, because not all CEOs and founders know. But yeah, that's one of the reasons that LinkedIn is so important. So to wrap up the podcast, I really loved seeing how you are involved in various philanthropic organizations, including SBP and Son of a Saint. So tell us a little bit about that. I think it's super cool when any leader is involved in anything that gives back. How did you get involved, and how do you combine what you do there with what you do in your business?
Yeah, so I'll talk about St. Bernard Project, SBP first. They were born out of Katrina. I moved to New Orleans in 2008, so 3 years after Katrina. And there was a lot of false leaders that came through that process of rebuilding. And it became real clear that SBP was a very intentional, well-focused organization that worked alongside the, the Toyota management system. They came out of and partnered with them to build their building process. They were able to shrink the time of rebuilding homes and the cost of it. And then they've become, since then, and I was a founding board member with them, so I was very excited to be a part of that. I've now since left the board, and the co-founders have left as well, and it's become a big sponsored corporate organization, decently funded, but they are forefront on national disaster recovery, and they now advise federal governments and state governments and the processes of how to rebuild communities. But also, when you're thinking about communities, people don't think about these big issues of like, the federal government put $60 billion to so-and-so organization. That $60 billion doesn't get to that community with all the red tape and the municipalities that get that money and then have to figure out how to disseminate. It takes like 6 to 10 years for that to occur. So they've really thought about how to move that along and rebuild these communities back fast. I mean, you look at the Palisades, they haven't even received their money. Those are different issues, but they haven't even received that money. So, but those are systems, right? And I really care about the huge 20,000 foot aggregation of systems, much like TPN, and how do we not just come up with a point solution to solve something? How do we come up to solve it all? And a new structure, how we approach that, systematically. And then Son of a Saint is one I'm not involved much with the operations. I'm more of a fanboy on the outside who gives money. I'm friends with the founder and head of it. I think they're in their 12th year. Sonny, if you listen to this, I'm sorry if I got that wrong. But they're a fantastic organization that has really also systematically taken the issue of boys that are disenfranchised, mainly because their fathers have been incarcerated or murdered, and generally in front of them. And so they're fatherless boys, and they bring these boys into the program at 8 years old, and they're kind of in for life. Like, they're part of the community, and we've helped them and the organization scale to be able to do 200 boys at once. This is only in the community of New Orleans. And then I talked to Sonny a lot. I've been pulled away just because of my day job, but I talked to Sonny a lot about how do we scale this in other communities, because people think about the Boys and Girls organizations, Boys Club, I forget what it's called, the traditional organization.
Boys and Girls Club, yeah.
Yeah, which is great, but this really is that in terms of filling gaps and therapeutic gaps and community gaps and academic gaps, and holistically looking at the boys and how they go through the life. And I've met a lot of the boys. They're wonderful boys, and it kind of takes you to a sense of humanity, where sometimes you could just walk by and see somebody and be like, oh, and judge, right? But we all have a shot, and some of us, me included, have had legs up above people in terms of maybe familiar, advantages I've had and things like that. So it's nice to systematically have a process where we can actually measure and see and provide and almost have a financial attached group that provides love too, which is a big ingredient in people's life. And we know, through the work of TPN and the clinical work, is boys are in trouble right now, and they're falling behind, and there are issues that are uncomfortable to talk about, but it's, and I don't know the specific numbers, but boys under 30, it's shocking how many boys haven't had an intimate relationship and would rather choose porn or video games, digital relationships, and never having those interpersonal skills to have a real connected relationship. And that stuff, gets branded in terms of your consciousness, and it's harder for you to re-engage with humanity and become detached and depressed and having other behavioral health issues that can down the road. So it's wonderful what Son of Hussein is doing and building that. And there's a reason they grab these boys at 8, because they're, you kind of lose them when they get older, and it's sad. And I've, I live now half the time in New Orleans, and you see that in the community of, a lot of the crime and things that happen, which are I don't know the numbers, but I would imagine very much driven from these abandonment issues and these trauma issues, right? And driven into areas that aren't positive aspects for their lives, turn into crime for communities and cities. So it's a great investment for cities to make what Son of Hussein is doing, and other cities should really do this. And we've seen an impact in our community around it, and I commend Sonny, who's also just a tremendous human being himself.
Amazing. Well, I love that we ended on that, Trevor, because it shows how much community, local initiatives can make a difference, and incredible to see, what you and your friend Sonny are all doing in the community, in addition to everything you're doing at TPN. So thank you for joining us today, and until next time.
Yeah, thank you, Kimberly. All the best. Appreciate you having me.